Infectious diseases are illnesses caused by tiny organisms called pathogens. These pathogens can spread from person to person, animals to people, or even through contaminated objects. They disrupt the normal workings of our bodies, leading to a range of symptoms. Pathogens come in different shapes and sizes. These tiny invaders can be found everywhere, from the air we breathe to the water we drink. They are invisible to the naked eye, but can have a significant impact on our health. Bacteria are single-celled organisms that can cause diseases like tetanus, which affects the nervous system. Not all bacteria are harmful. Some are essential for processes like digestion. However, pathogenic bacteria can lead to severe health issues if not properly managed. Viruses, even smaller than bacteria, need to hijack our cells to replicate and can lead to illnesses like the common cold or influenza. Unlike bacteria, viruses cannot survive without a host. They invade living cells and use the host's machinery to reproduce, often destroying the cells in the process. Fungi, another type of pathogen, are responsible for infections like athlete's foot. Fungi thrive in warm, moist environments and can affect both the skin and internal organs. Some fungi are beneficial, like those used in antibiotics, but pathogenic fungi can cause serious health problems. Protozoa, single-celled organisms often found in contaminated water, can cause diseases like malaria. These organisms are typically transmitted through insect bites or contaminated water and can lead to severe illnesses, especially in regions with poor sanitation. Finally, parasites, such as tapeworms, live in or on a host, drawing nutrients and causing harm. Parasites can be found in various environments and can infect humans through contaminated food, water, or direct contact. They can cause a range of health issues, from mild discomfort to severe diseases. For centuries, humans were unaware of the existence of these microscopic foes. People believed diseases were caused by bad air or supernatural forces. The invention of the microscope changed everything. Suddenly we could see these tiny organisms. Scientists like Louis Pasteur and Robert Koch proved that specific germs caused specific diseases, revolutionizing medicine. This is known as the germ theory of disease. Why all the fuss about hygiene? The discovery of germs led to the understanding that hygiene is crucial in preventing the spread of infectious diseases. Before this discovery, people had little knowledge about how diseases spread, and many illnesses were attributed to bad air or supernatural forces. The realization that tiny invisible organisms could cause sickness revolutionized medicine and public health. Doctors and nurses are at the forefront of this battle. They work tirelessly to ensure that patients receive the best care possible while minimizing the risk of infection. Their role is not just to treat illnesses, but also to prevent them from spreading. This is why they wash their hands meticulously, following strict protocols to ensure that no harmful germs are transferred from one patient to another. Hand hygiene is one of the simplest yet most effective ways to prevent infections. They wear masks to prevent the spread of airborne pathogens and use gloves to create a barrier between their hands and potentially infectious materials. These practices are essential in maintaining a sterile environment. Masks prevent their spread through the air, capturing droplets that may contain harmful germs. This is especially important in settings where patients may have respiratory infections, and gloves act as a barrier, protecting both the healthcare worker and the patient from direct contact with infectious agents. This is crucial in procedures where there is a risk of exposure to blood or other bodily fluids. These practices protect both healthcare workers and patients from infections. By adhering to these hygiene protocols, healthcare professionals play a vital role in controlling the spread of diseases and ensuring a safer environment for everyone. Protecting yourself and others. In this section, we will explore the essential steps we can all take to protect ourselves and those around us from infectious diseases. Just like doctors, we can all play a role in stopping the spread of these microscopic invaders. It's not just about medical professionals. Every individual has a part to play in maintaining public health. Simple habits like regular hand washing which should be done for at least 20 seconds with soap and water, can significantly reduce the risk of infection. Covering our mouths when we cough or sneeze, preferably with a tissue or the inside of our elbow, helps prevent the spread of germs to others. And staying home when we're unwell can make a big difference. This simple act of self-care not only aids in our recovery but also protects our community by reducing the chance of spreading illness. By understanding infectious diseases and adopting good hygiene practices such as using hand sanitizer when soap and water are not available, we can minimize the risk of transmission. We can create a healthier and safer environment for everyone. Together, through these small but impactful actions, we contribute to the well-being of our communities and ensure a brighter, healthier future for all.
Keep curious and keep exploring the natural world around you. Thank you for subscribing to BioFun channel, where your curiosity fuels our exploration of the fascinating realms of biology.